Bismillahirrahmanirrahim. I start the CME with the name of Allah, who is very, very kind, helpful, merciful. CME update by Mother and Child Survival Group of Pakistan. Me, Dr. Tariq Ops, Gynae Family Emergency Specialist Internist, Gulf KSA, presently a district gynecologist. A pregnant woman taking Carbamazapine and Valporate, non-epileptic, came to you for your advice. You have to deal the patient sympathetically and has to counsel, and it is important that epilepsy as it is has got no adverse effect on the pregnancy, but few things has to be considered, and those are that preconception, it should be tried to be the epilepsy should be well controlled and medically optimized, and it should be at least for 1 year and 6 months fit free, 1 year fit free, optimized, and on minimum monotherapy if possible, and the fits be controlled. And also before conception, 4 milligram folic acid to be given before 1 month of conception, and then continue till the end of pregnancy to counter the antifolate actions of these antifolate action of the anti-epileptic drugs. The single if seizure has got no effect on the baby, but continuous seizure can cause a fetus hypoxic, and neurophysician has to be consulted to so optimize the doses, and if possible on monotherapy. And the risk of these valporate and carbamazepine on congenital anomalies are there, and especially valporate is fetotoxic, teratotoxic, and also risk of double and also they cause neural tube defects, both can cause. And then with the double drugs, the risk is 50% GCA, and with single it is 6 to 7%, and it has also to be observed, and the risk is there, and but there is no adverse effects. There could be miscarriages, but there is no other obstetric complications are there. Now, what are the implications on the patient? Patient implication for the social security, for the licensing, for the medication, and for the folic acid, and the precipitating factors of the seizures. And then come the monitoring is have to avoid the precipitating factors, control of the seizure, precipitating factors for the seizures. And then it has to be patient antenatally to be monitored, drugs to be taken, and compliance to be there, and folic acid to be taken. And in the anomaly scan to be done at 22 weeks, and then can be alpha fetoprotein, and for the amniocentesis if needed. And then comes the third trimester, after 34 week NST everywhere, and growth scans are there to be given. And after last 4 weeks of the third trimester, the tablet for vitamin K should be given to cover the hemorrhagic disease of the newborn. Later injection can be given to the newborn as well. Regarding the breastfeeding, it is important that the withdrawal effect or sedative effects of the drugs to be considered, and breastfeeding avoided in the peak level of the drugs. Then contraceptives, you see, higher dose has to be given for the folic acid. A higher dose has to be given for the estrogen in cases of carbamazepine and valporate. So it could be maybe 50 microgram or 100 microgram. And the barrier contraceptives, Mirena and progesterone and intrauterine, then Mirena and depo progestogens are good for the breastfeeding and as well as for the contraceptives one. And there are also the other drugs, like newer drugs like clonazepam, valporate, and lamotrigine, vigabatrin, and gabapentin. They have less enzyme activity. The progesterone only drugs has got they have got the enzyme inducing activity and can, so higher doses are needed. So these are the important things which the contact with the multidisciplinary input, and especially the neurophysician and the EEG, are very important, and to optimize the treatment and for the control of the epilepsy, and possibly, if possible, monotherapy is needed as compared to double therapy, and if they are controlled. So and effects on the baby's transmission of epilepsy, genetic counseling to be considered. So these are one of the few brief review on epileptic. Thank you for your patience listening, and we must not forget that when we leave this world, La ilaha illallah Muhammad Rasulullah should be we should recite, and La ilaha illa anta subhanaka inni kuntu minaz zalimin, and trust وَكُفَى بِاللَّهِ وَكِيلًا وَكُفَى بِاللَّهِ نَصِيرًا Subhanallah wa bihamdihi Subhanallah al-Azim. So we must not forget our glorious past. दी अजानें कभी यूरोप के कलीसाओं में, कभी अफ्रीका के तपते हुए सहराओं में. वो Thank you for a very patient listening. We'll come with another review of some new CME. Till that, best wishes and luck. Goodbye.